Well, I have the pleasure today of speaking with Dr. Gil Lancaster, who spoke at our fall conference and talked about his book, Embrace. And Dr. Lancaster, thank you for joining us today. What I'd like to do is have you explain what was the genesis for Embrace?
It started back in around 2007 when a group of us were actually at someone's house, a neighbor's house, and was listening to a candidate for a congressional seat. It was his first time in politics, and he was very impressive. He had great credentials. He was a Rhodes Scholar, and he worked at Goldman Sachs and the whole thing. But then he said, that when someone asked him, what do you think about healthcare reform? He says, I really don't know much about healthcare. And it sort of struck me that, first of all, anybody who's running would be honest enough to say that they don't know something, which was really...
That makes a unique candidate.
Right. And then there was a bunch of us healthcare professionals, mostly doctors, in the group, and we get up and said, we'd be happy to help you out with that. But before we met, with him, we said, well, what are we going to tell him? So we sat in someone's living room and basically came up with the beginnings of Embrace. We were able to then expand to other areas, people who knew a lot about HIT and people who were experts in public health, healthcare economics, and so we got a lot of input in how we could do this. One of the co-authors on the Embrace article was actually a professor of business administration. So we have a very diverse group.
So one thing that really impressed me about the Embrace concept and maybe came at the right time for me is I have reached my limit of the stalemate in Washington, and what Embrace really said to me was we need to redesign the entire system as opposed to maybe scratching at the edges through different types of reform efforts. But I really like kind of what I might call the three pillars that are so foundational to the Embrace concept. Could you talk about those three pillars a little bit?
So the first pillar, which we now call innovation, is the tier system. The tier system allows you to really practice the way you would practice normally without having to worry about what the guidelines say one way or the other as far as coverage. The HIP, the Health Information Platform, sort of grew out of a concept that everything needs to be unified and easily accessible, and we know that that's possible now. We have, when we first introduced it, computers were just starting to get powerful enough, but now in 2017, I think computers have really progressed so that we are able to do all these data mining and be able to keep store all these data and make them easily available very quickly. So we really believe that is possible, but will unify a healthcare system in a way that is interoperable and easy to use and allow easy access to information. And then the National Medical Board, I think that I have to say that we came up with that, we thought uniquely in that living room. But it turns out that Tom Daschle had just written a book, which none of us had read, but then someone made us aware of it, that mentioned the same kind of concept. So it is something that's natural, right? I mean, the Federal Reserve is an institution that people like to complain about it, but it is truly organize our economic system to be efficient and effective and competitive with all the other economic systems in the world.
And not subjected to political whims.
Exactly.
Of who's
in
office.
fact, that's part of the reason why a lot of politicians don't like it, is because they can't influence the decisions that are made by the professionals, the people who know what the heck they're doing, right? And that's what we need in the healthcare system. We need the professionals running the healthcare system.
Well, I was extremely impressed with the concept. I think this is exactly what our country needs. I don't have any financial conflict of interest there. I just simply think it's worth your time. It's not a lengthy book, so you can easily digest it and finish it. And I love how you organize part of the book in terms of how does this impact healthcare physicians and other caregivers? How does it impact government? How does it impact people? How does it impact insurance companies? So it answers most of the initial questions that some of the concepts naturally raise in terms of, so what are the consequences of this model? But having studied a number of the other westernized healthcare systems around the world, I truly do think Embrace takes many of the best qualities of some of those systems and puts them together in I'll call it a uniquely United States or American way.
And I think that's key. I mean, a lot of the criticism about single payer is that it's a foreign system to the United States, and it really is. I mean, it's foreign not just to the consumers and the patients, but it's foreign to the providers themselves. I think that part of the reason why we've become a very innovative medical system is because of the way that our healthcare system is organized, and we want to keep that. We want to keep the entrepreneurial, aspects of the American healthcare system.
Well, thank you very much for your time. So if you have an interest in changing our healthcare system, truly changing the system, not just insurance reform, I think you'd find this idea very intriguing, and particularly if you're a health professional, I think you'll like so many aspects about it that I think it's a viable model that needs discussion. And so thank you for your time. Thank you for speaking at our conference.
My pleasure.